are committed to creating and sharing knowledge that empowers children and young people to understand the steps they can take to reduce their risks, increase their resilience to mental health problems, and improve their mental health.
Our vision is to create a world with a sound mental health for all.
People do attempt suicide.
Naturally, people are bound to judge, but judging and expressing the judgment is something that we can reserve for ourselves.
We find that suicide bereavement is even more difficult than losing someone through natural death.
Be empathetic in the way you approach their situation, because if you show too much sympathy, they will also start feeling guilty.
Greetings to you all. Welcome to our show, Tap In.
Let's say you feel that you are depressed, you are failing to cope. First thing that you need to do is to seek help. So each time that you feel that you are not coping with your problems, look for someone to talk to.
When we're talking about culture, we're talking about the customs, the practices, the beliefs that we hold as a people. And if you look at the African context, or you're looking within Zimbabwe in particular, there are certain beliefs and certain ways of being that we have as a people that you might find pushing young people especially towards suicide. Parents put a certain amount of pressure for one to perform. And in instances like that, you find that this is where people end up committing suicide because they failed a module, or they're failing to move on in their studies, or their studies have been halted for whatever reason. And people end up thinking, well, I've been such a disappointment. The only thing to do is for me to take my life.
When someone is suicidal, it's very difficult to tell that the person is suicidal, because a lot of us have got a judgmental approach to how things are, or how people look at. By its nature, suicide, for those people who commit suicide, they're basically there to punish the people that are left behind. So in most cases, they're looking for attention. So we need to be able to give an ear to listen and to pay attention to what details, or what hints they put across for us to know.
Hello everyone, welcome to our show, Tap In. Today we are going to discuss on Suicide Series Part 3, and our topic today is how to identify a suicidal person. So I am Tawanda Mrepa, the director and founder of Young People Mental Health Trust. This show is brought to you by your pet child, the Young People Mental Health Trust. And today we have our guest, Dr. Muchena is here with us. So we're going to discuss on how to identify a suicidal person. So to start our discussion, we're just going to ask a random questions to Dr. Muchena. So can you introduce yourself, Dr. Muchena?
Thank you very much, Tawanda. My name is Kudakwashi Muchena, and I'm a research psychologist by profession. I hold of a PhD in research psychology and a master in research psychology. I've been wide experience in research and mental health and for teaching at university. Thank you for having me.
Okay, so for us to actually start our show, we have a question now on how to identify that someone is suicidal.
Thank you very much for that. Usually, when someone is suicidal, it's very difficult to tell that the person is suicidal, because a lot of us have got a judgmental approach to how things are, or how people look at. When one person walks into a room, if a person walks into a room, it's natural that we want to judge them either by their looks, by what they say, or by what they dress, and so forth. So we need to be very careful in terms of understanding that before we can actually say to such person, this person is actually highly suicidal. And in most cases, people who are highly suicidal are, by its nature, suicide, for those people who commit suicide, they're basically there to punish the people that are left behind. So in most cases, they're looking for attention. So we need to be able to give an ear to listen and to pay attention to what details, what hints they put across for us to know.
Okay. Our last show from last week's conversation, Dr. Mchambara also highlighted the issue of someone who is trying to isolate himself or herself from the crowds, and also issues to do with depression, the issues to do with whereby someone is actually like, I'm not worth it. I deserve to die. I'm not worth it. I'm not good at what I do. So, do you also agree on we can actually identify maybe someone is suicide, maybe through those issues that we raised last week, or what do you think regarding?
Okay, thank you very much. I think I just need to add on that. While it's common practice that a lot of people who commit suicide, usually they are highly depressed. They face a lot of other social challenges along the way. But it is also pertinent to understand that I want to give an example that someone, if you ask a suicidal patient what they hope for, they'll tell you that life is worthless. I can't do this. I can't do this. But if you are to give them an opportunity to actually say to them, how would you feel if a colleague if someone close to you was to die and you to remain? That's when you realize that's when they cannot come to reality to realize that to kill. Sorry, my network it just disappeared. So I'm saying they realize that life might not be worthless, but the moment you realize you give them time to listen, you actually approach them, they will realize that life can actually be fruitful and can be worth it. So in most cases, you realize that their perception, or their understanding, or their view of life is the one that is distorted. That's why people talk about the cognitive distortion of realities and so forth in most suicidal cases. So they have that distortion of reality that they cannot be worth it, that life is not worth it, that there's nothing that they can do right. So they believe that everything that they've done or everything that they can do was being wrong. And I think that's how we can identify how a person is suicide or not.
All right. Okay. Thank you actually for clarity, for giving clarity on that one. And also, we would like to actually, let's say we have a suicidal person that we have, and then we want to actually do the assessment on the suicidal risk. How do we then do those assessments, and how do we then do in terms of helping the person who is actually having those suicide ideation? How do we now have those what we call it, the assessing the risk, the suicide risk? How can you tell us about the process of assessing the risk of suicide?
I want to talk more into the idea of listening non-judgmentally. A lot of as a therapist, I think the most important thing is to be able to what is regarded as effective listening. Like I said before, you naturally people are bound to judge, but judging and expressing the judgment is something that we can reserve for ourselves. So as a therapist, the first thing that you need to be able to do is to be firstly on your own, reflect on your own state of mind. Are you ready to accept whatever that the person before you is going to tell you? This is like you are looking at what is the mental state at the point they walk into therapy or they look for us for help. So once you understand your state of mind, you'll be able then to say, I can actually listen and actively help this person without using my own perception or understanding of the situation. I want to give an example of someone walking into your room who wants to commit. For example, a prostitute walks into your room. They want to commit suicide because they've been raped. Naturally, you are bound to judge that how can a prostitute be raped? But the moment you express that to them, they feel worthless and they feel that they are not really worth it. And then that may result into a crisis. But if you accept them as they are, say, they're human beings, yes, they have been violated, yes. So what's the story? So that's the first point of call. Once you understand that, then you'll be able to then say, okay, so Lolo, how do we then help you from this pain? How then do you try and correct that cognitive default in terms of understanding and appreciating, while that they are really worth it, they are not worthless as they think. There is still hope and there's still life to them. So that's basically the process. Then after that, then you then be able to come up with a program of therapy to say what is it that we can do working together.
Okay. Thank you so much. During our WhatsApp presentations, I think this to the audience, we did this series on our WhatsApp platforms, and we discussed these issues about how to identify that someone is suicidal. And from that presentation that we did on WhatsApp, we had a guest, Dr. Kajau. He's not here with us today, but he highlighted some issues on how to identify that someone is suicidal. So those issues now, I'm going to actually talk about them, and then we actually discuss here with Dr. Muchena. So he also said about we should ask questions to ask. He was like, okay, ask about the suicidal plan. Do the person have a suicidal plan? And if so, how do they intend now to take their life? And how are they going to do that? And where are they going to do that? As it is very important now for a person who is actually dealing with someone who is suicidal to have that sort of information, since it will actually help you to understand the level of suicide. Is he willing to? It will actually help to identify the level of risk. Let's say, for example, we have lower risk, whereby someone has actually no suicidal plan, no clear intentions, willing to talk about the stress or depression, is supportive in terms of family and the significant others, and willing to comply with the treatment. And also, now we also have the moderate risk, whereby someone has no clear plans, but plans are there, but they're not clear. And whereby also someone has shown the exhibitors of good judgment, a supportive family, significant others, and also willing to comply with the treatment recommendations. We also have the higher risk, whereby someone will be actually having the specific suicide plan, and also have impaired judgment, and also psychosis, and actually on chemical dependence, where someone's actually using the substance abuse. So these are actual risks. We also have the community suicide intervention view of every and each risk. So we also discuss our tips on possible interventions after assessing the risk. We actually start with the lower risk, checking on them. We should actually check on them, connecting to the significant others, so that they can actually get help, and try to remind about the coping strategies. And also on moderate risk, try to have someone close by as much as possible, and also try to communicate with church mates, seek interventions for depression. On severe risk now, we need to remove dangerous chemicals or weapons, and also to remove the person from current environment, share the information with those those who are close to that person, and reach out to mental institutions. So I would want to come back to you again, Dr. Muchena. Can you actually clarify on those points that we raised on our WhatsApp platform? Do you actually agree on that assessment?
Thank you very much, Tawan. I agree totally to a great extent. The level of risks in terms of exposure to suicide are very important in terms of understanding how to manage the suicide case. Usually, when someone walks into therapy, they are likely to have a plan already. when someone is highly suicidal, especially when you look at different ages. I think age is also an important factor in terms of understanding suicide. For the youth who are especially who are on comorbids like drug use or other mental health, who have other mental health disorders, depression, psychosis, etc., etc. The chances of them highly suicidal is very high. The risk of suicide amongst those ones is very high. But the only challenge that they face is that for someone who is on other medication, they might not have a very properly outlined plan for that. It's unlike someone who doesn't have any other stimulus, other whether drugs or psychosis. They're likely to have a formulated, a proper suicide plan that they are prepared to execute at any given time, given the opportunity. So those ones are very high risk, but because of the nature of their mental state. But it doesn't necessarily mean that those also low risk or moderate risk do not necessarily commit suicide in the end. The fact that they walked into therapy, I think they need proper attention, the same at almost the same level, to say then how then do you handle them? How do you ensure that? Do you think they need custodial? They need to be in the care of someone, or they need to be, depending on the plan that they have. If the plan is related to possibly using a rope or something, then they need to be in the care of someone who is very responsible. If the plan relates to use of drugs or tablets or other toxic chemicals, then the plan should be focused on ensuring that those items are not easily accessible to the person. If the plan is to possibly jump off a building or other means, then you have to ensure that they're always in the care of a significant person or a respectable person who can actually be able to take care of them until they're out of the woods. I think that's basically how a plan for suicide should be able to take care of. The church always play a key role in terms of helping people who are highly suicidal. Once support from the families is guaranteed, or the church or the community, it will actually be helpful to someone who is planning to commit suicide.
Okay, thank you. Now we want to talk about listening non-judgmentally. You highlighted that one before. Now we're saying a person now is actually come or brought herself to you as a counselor, and now how can you then be able now to listen non-judgmentally? It's a skill by its own right, and a lot of profession don't have that skill. So why is it so important to listen non-judgmentally?
Okay, thank you very much for that. This is a very difficult skill that you really find in a lot of people. Being judgmental is natural to everyone. We judge people every day, but to be able to be then non-judgmental is actually a skill that you need to be trained on. And basically, I'll talk about 5 things on listening non-judgmental. First thing is to reflect on your own state of mind. Second thing is to adopt an attitude or genuineness in terms of being empathetic. Thirdly, I'll talk about using verbal cues in terms of listening. And fourthly, maintaining a positive body image. And fifthly, it's about recognizing cultural differences. When you say reflecting on the person's own state of mind, you're saying it's not a therapist is not someone who has achieved it all. A therapist is someone who also has their own problems or challenges in society. So the difference between a therapist and an ordinary person, a counselor and an ordinary person, is their understanding of themselves. To say that, whilst I've got my issues, I'm a therapist and I need to help people and I need to support them. So that's what a therapist should be able to do, to be able to understand themselves and to be able to be in a state of mind that shows that they're actually prepared or ready to help someone, especially in a case where suicide is involved. Because a suicide person is not a very dull person. They have a plan, they have an action to take place, they know what they want to do. So the moment they see cues in your mind, in how you express yourself, or in your state of mind, they will likely to execute their plan because they don't see any reason why they shouldn't be. Then the second part is adopting an attitude of genuineness or an attitude of empathy. You want to, as a therapist or as a counselor, you need to be able to position yourself in their shoes and see life from the way they're seeing it. If they tell you that they feel that life is worthless, it means they're seeing life from that perspective. And you should be able to also understand life from their perspective, to be empathetic in terms of understanding how they're presenting their case to you. Once you do that, you'll be able to then to say, okay, so how then do we move on from here? How then do we change that perspective into something that is more positive? Then also the use of listening, verbal skills. Usually, when people start speaking, a lot of us would want to interject and come in and possibly give an explanation or give a justification. But as a therapist or as a counselor, you need to be able to just use verbal cues. Yes, go ahead. I can hear you. I see. Yes. That kind of thing encourages the person to actually speak out their mind and express themselves without fear of being criticized or being judged. Then your body tone, your body language also is something that also speaks a lot to someone who is suicidal. If you continue, if you yourself is not actually comfortable engaging in such a conversation, the person who's looking for help will quickly pick it up, and they will not feel comfortable engaging you because you are also uncomfortable yourself. Your body language tells you that you're not clear, or you're not comfortable in this discussion. I want to give an example of someone comes to you and say to you, they're not Christians and they don't believe in prayer. Chances are that you want to jump up and say, I can't handle this. Or someone comes to you and say, I want to commit suicide because I am gay and I'm not acceptable in my family. So you are likely to react in a certain way. And once that person realizes that you're not comfortable with that discussion, your body language sells you out, they're likely not to cooperate with you going forward because they don't actually believe in what you are selling to them. Then the issue of recognizing cultural difference is actually very important when you are dealing with suicidal cases. You need to understand the culture of the person, not your culture. Being conscious of your culture is important, but also being conscious of your client's culture is something that is more important as far as helping the client. Because if you try and impose your values or cultural beliefs on the person that you're helping, chances are that it will not be in their best interest. So you need to be able to understand their culture and understand and appreciate the difference that we have. Thank you.
Okay. We also highlighted the issue for being there and helping suicidal individuals to connect. Why is so important for maybe communities or maybe a therapist to being there, to help those suicidal individual persons to connect. And we also highlighted the issue of we should not leave them alone. We should also do our best that we can to remove any other dangerous, it might be chemicals or some weapons that they might use to actually hurt themselves. So how now best can we actually be there and actually help a suicidal person to connect rather than non-judgmental? You highlight issues to do with non-judgmental, which is actually one of the focal point when it comes to being there. You need to be non-judgmental, and also you need to make sure that you try by all means to remove any other dangers that can be associated with the person to actually engage into a successful suicide. Can we use attempt? But how can we then be there to help that person to connect?
One of the things that I believe in is creating a community of support. Usually, when the person they're basically feeling isolated or feeling lonely or feeling out of place. And in most cases, they feel they're not connected to significant others. And the challenge, therefore, is to ensure that we eliminate that by creating a society, a community of people, a community of support, a community of like-minded people who work together in terms of ensuring that they get the support that they need. You know, let me refer back to the issue of being homosexual or gay or lesbian, whichever way you think of it. Once that person is not acceptable in their family for being, or in their community for being homosexual, they are likely to be isolated, and everyone judges them because of their sexuality. But that person can be brought into, can be advised to join a community of people who are like-minded. Like, for example, join a community of homosexual, a grouping of homosexuals, the girls, in other organizations. So that will then provide a platform for support. That will then provide a platform in terms of having people who actually believe or which actually understand their situation. The same applies to our youth. When someone is involved in a lot of drugs, abusing drugs and so forth, the way that they can be assisted is trying to take them away from that community, which is harmful to them, and place them in a more accepting and accommodating community that is free from drugs. So once that person is separated from the community that is good access to such toxic drugs, then they can be helped. But as long as they remain within the same society or the same community, it is actually difficult for them to be helped. So, because chances are, if you try and remove these chemicals or the drugs from the person, there might be very little success. But if you take the person out of that community, place him in a different community, I think that would help very well.
Okay, yeah, thank you so much for raising that one. And also, we have the issue of the church and the society playing together actually to help a person to connect, and also talk about the issues to do with follow-ups. You know, you actually need to actually keep on enhance the follow-ups, especially when we identify that someone is suicidal. We need to keep up doing those follow-ups. So we have a question here that I want to ask you regarding on gender. Why is it like men actually commit suicide than women? Do we have an explanation on that one? And also men actually, and also why do men commit suicide more than women, and why do actually men suffer much more in terms of if more problems in terms of mental health problems and disorders than women? Do we have an explanation there based on research or?
Okay, thank you very much for that. There's a very good, there's a very simple explanation to that. Statistics have shown that women have got, in terms of numbers, they've got high percentages of suicide ideation or threat to suicide. That's what literature says. And men and boys, they've got very low in terms of suicide ideation, but they've got very high suicides than women. Women threaten suicide, they have suicide ideation, but in terms of execution, they rarely have high rates. It points to basically two things. Firstly, it's about health-seeking behaviors. Men are poor at health-seeking. Men don't cry. Our culture in our society is so that we were told you need to be men up. Men don't cry. In not crying, you are bolting it up, the depression, you are bolting up everything into you. And when you explode, that's why men, by the time an idea to commit suicide comes into them, they already have a plan to do it, and they can actually execute it. For women, it's a build because of their better health-seeking behavior. They're likely to talk to a friend or a colleague or to church members or to look for help. And in most cases, they can be helped. So that's why the rates of suicide amongst women is very low. And that's why we have a lot of men committing suicide. So it's basically an issue to do with culture. It's also basically an issue to do with behavior amongst most men in our society.
Okay, exactly. Women have actually good behaviors when it comes to health seeking. They have actually good health seeking behaviors than men. Our society don't allow us to speak up. Our society don't allow us to cry. And then now, how best then can we actually advocate for boys and men to actually, say, no, we are also human beings. We actually suffer and we have also those problems. How can we then create a community that can actually accommodate that thinking, if I may say?
The creating such a community is something that we cannot overcome overnight. I'll give you a very good example. The chances of we always complain why boys end up in prison, but if you ask yourself, if a boy and a girl were going to go on a date, who is going to pay? So the boys are expected to pay. Where do they get the money from? They are likely to steal. So stealing will lead them into prison. So that's why we have a lot of men in prison than women, because of gender roles that men are supposed to play in society. So in terms of helping us, in terms of going forward, I think we need to raise our boys differently. We need also to raise our girls differently. Raising our boys differently means that we need to accept to enforce in our boys that they are allowed to not to have money. They are allowed to also cry. They are allowed to be vulnerable. We also need to tell our girls that they raise our girls in a way that says it's not just, you don't need to be dependent on a man. You can also be as strong as you are. You can also make it as you want. So that we create in future, I think 20, 40, 50 years to come, we create a society where men can actually feel vulnerable, the same way that women can feel vulnerable. Because the society that we live in at the moment, men don't cry. Men are not vulnerable. If you're a man and you're vulnerable, then you're a weak man. Because the gender roles specify that you need to be a protector, a provider, and be able to be men enough. And our women are supposed to be receptive and acceptable and loving and caring, which attributes are not actually gender specific. They can be found in both men and women.
Okay, thank you so much for giving clarity on that one. And also we have some questions, especially on counselors. Some counselors also suggest that when you are dealing with a suicidal person, you don't need to be empathic. You just need to be harsh sometimes in actually helping them to overcome those actually scenarios. So how and what is your view? You actually talking about non-judgmental, and then we have some counselors who are like, okay, you don't need to show empathy, you don't need to show that much love when you're dealing with someone who actually tried to commit suicide.
I think they borrow from one guy called Viktor Frankl. Very highly controversial, I know, but what he said was that if a person who wants to commit suicide gets to a counselor, what the counselor needs to do is just to tell him to go and commit suicide. The moment you say that to a person, go and kill yourself, chances are that they're not going to kill themselves. But what happens if they do?
Yeah.
Then you remain. Then you are. But in most cases, it's a brutal way of doing things, which has been very helpful in certain circumstances, but not in all circumstances. In some circumstances, you need to be very empathetic. You need to listen and follow through. While in other circumstances, especially when you're looking at issues to do with marital issues, where a woman wants to commit suicide because of marital issues, if you just ask them what is going to happen to your children, chances are they will then try and refocus and see what is going to happen to their children when they're passed on. Because their thinking is that they want to punish their partner in the process, they're also punishing the children. So once they realize that by committing suicide, they are not actually punishing the person that they are targeting, they then try and rethink how to commit suicide. So it's a highly controversial one, but it's something that you need to be very careful when you take that approach of not being empathetic. And yes, you can be that brutal and being harsh and hopefully get a positive result. If you don't get a positive outcome, you're likely to remain with you for years.
Okay, thank you so much. Thank you so much actually for raising out that one. Okay, to our viewers, we are actually doing this live because we are still in the pandemic of COVID-19. So we just want to make sure that we actually adhere to the regulations. So let's max up and keep on social distancing to actually, to remain healthy and actually also cover those WHO regulations. So thank you so much, Dr. Muchena, for actually being our guest today. You actually bring out some of those information, some of those hard topics. You actually make it simple, and we hope we will actually come back to you soon. So thank you so much for being on this show today.
Thank you very much, Tawanda. It's good to have me on the show.
We all know that death on its own is not easy. When you experience death, you go through what is called grief or bereavement after the experience.
To understand that they are not the ones to blame for this condition. So in order for them to reach acceptance, you may, as a relative, you may not be able to assist them through it all, but if you take them to a professional, somebody, professionals can help them to go through the process of healing.
Okay, thank you. So we just come up to an end of our show. Tap in, meet us next week as we're also discussing some other issues. We are still on suicide series. So meet us again next week when we're talking more about suicide.